There's room for improvement in today's osteosynthesis techniques. Mini and micro plates made from pure titanium or titanium alloys are nowadays standard in oral and maxillofacial surgery, representing the state of the art. The biocompatibility of titanium implants has been thoroughly investigated and demonstrated in many scientific studies. Nonetheless, conventional application techniques using titanium still have disadvantages. These can be summarized as follows. The necessity of a second operation. Despite its biocompatibility, titanium still is a foreign body for the human organism. This generates controversy amongst experts as to whether implant removal is necessary or not. There is, however, a consensus that a follow-up operation for implant removal is indicated, particularly in the case of young, growing bone. Application requires firm cortical bone. Titanium bone screws rely on the interface with the surrounding bone for the fixation strength. This bone quality, especially in a young patient, is often very thin and cancellous, which can lead to poorer fixation. Palpability and susceptibility. In some patients with particularly thin tissue, they can feel the edges of the inserted implants, especially when large surface implants have been inserted. In extremely cold climates, implants can lead to higher sensitivity to temperatures. Migration, displacement, and dehiscence. These factors represent a limitation in the use of metallic implants in the growing bones of children or infants. The potential for migration has led to a more prevalent use of resorbable fixation in the growing cranium. It is exactly the developmental stage, however, that is ideal for the surgical correction of craniofacial deficiencies and malpositions. Slow application, slow extraction. Exact bending of the implants is an essential requirement for successful fracture repositioning. However, pre-shaping is very time-consuming, especially when using large surface implants or implants with large diameters. Implant extraction means a second operation for the patient and carries all the disadvantages of a surgical intervention: time and cost expenditure, infection risk, anesthesia, etc. The introduction of resorbable implants has been helpful in eliminating or reducing some of the disadvantages of using titanium in the growing cranium. Nonetheless, resorbable materials still have limitations. Time-consuming application. Most resorbable implant systems must be heated up first before they can be shaped. Further, the screw holes must be drilled and tapped. This is especially disadvantageous for difficult time-consuming craniofacial operations where numerous screws are used. Application requires firm cortical bone. Resorbable systems also require firm cortical bone for reliable fixation. Other companies have tried to create tack systems or rivet systems, but to date there is no resorbable osteosynthesis system available on the market that can make use of the trabecular bone structure for fixation. Up to now, there is no osteosynthesis system available on the market that can use bony capillaries for a base. Low mechanical stability. Low mechanical stability still represents an important weakness of the resorbable systems, particularly when used in load-bearing regions such as the mandible.